Hello, I'm Philip Mason Joyner, one of the incident commanders here at Clackamas County's Emergency Operations Center. As of this morning on May 8th, 2020, Clackamas County has 241 cases of COVID-19 and 8 individuals have died. Yesterday, the governor held a press release announcing finalized plans for how counties can begin to reopen some businesses. We are working very hard here at the EOC to put the required elements into place here locally at Clackamas County with input from our residents, and I wanted to share some information about the different elements of the requirements and progress towards where we are at here in Clackamas County. There are 7 criteria that we must meet in order to submit a request to reopen to the governor's office. They are the ones that are ultimately responsible for reviewing our plan and making the decision on if they'll approve counties reopening. The first counties will be able to reopen about a week from now. First, we must ensure that there is adequate supply of personal protective equipment for our healthcare workers and for first responders. We need to make sure that there's sufficient number of face shields, masks, gowns, gloves, and other critical medical supplies so that patients can be treated safely. Supply chains, they continue to open up, and businesses are going to make sure that they can access supplies to operate their businesses safely through their normal channels. The second requirement is that we continue to work with our healthcare system partners across the region and here locally in the county to ensure there's testing capacity to meet the needs for our residents. Clackamas County and our healthcare partners need to have enough capacity here locally that we can conduct at least 1,245 tests a week. Third, we have to make sure that our medical facilities have the necessary space and equipment to hospitalize, to care for, and eventually release patients in a safe manner. We have to have a solid plan in place if our hospitals get overwhelmed, and we've been working on this element of the requirement for quite some time with partners. Fourth, in support of the previous requirement, counties, they have to make sure that we have adequate spaces available for patients when they're discharged from the hospital, that they can self-isolate safely. So if they're concerned that they're in a household or in a living environment that they might expose others, we need to have enough motels, hotels, and other locations across the county where we can have folks stay for a temporary amount of time to recover. Fifth, we have staff that are working very closely to monitor all of our local public health data. We have to really have good insights into making sure that we have fewer patients being admitted to the hospital with COVID-like symptoms. And we want to be seeing that we're having less hospitalizations than we would for a normal flu season. That is one of the governor's requirements. This data is something we're reviewing regionally and also with our hospital and with state partners. Yesterday, the Oregon Health Authority released guidelines for sectors of the community that can open during phase 1 of the reopening plan if all of the other criteria are met. This helps to meet the 6 requirements for protecting employees once they go back to work. And then finally, the 7th element of the plan is contact tracing. This is work that our public health division has already been doing and been able to keep up with. But we need to make sure that as we reopen that we have adequate staffing to be able to investigate all new patients and all of the individuals that those patients may have potentially exposed. As the community reopens, there's great potential that we will see more cases, potentially more outbreaks, and quite likely more deaths from COVID-19. We will have to have a larger local public health workforce to keep up with this demand. We've already increased our infectious disease staff over the past couple of months, and we will have to continue to have more temporary staff to help support these efforts. You have already done so much by physically distancing, and we greatly appreciate your help as we work through the impacts from this virus. I want everybody to know we are working as hard as we can on this reopening plan so we can gradually begin to reopen things and not have to roll back any of the sacrifices that you have made. We thank you so much for your continued efforts. We thank you for your patience. We are all in this together. Thanks.